Now, so this is Tuesday night, trying to get the tech sorted out. Still can't go on Instagram, but I have reason to believe this is on Facebook and YouTube. Just tried to do it on TikTok as well, because I saw a thing on TikTok that it said live. But apparently you need over 1,000 followers, and I haven't got 1,000 followers, so can't go live on TikTok. But YouTube and Facebook is active still, I believe. It just shows you it's not good to just go for one platform, because this Instagram thing, there's no way of contacting them and no way of trying to find out why it no longer works. And I've Googled it, and apparently other people have had a similar problem. It just starts working one day, but it's not working today. So I've got to be happy with what we've got. It's one of life lessons, that. So good evening. I've got some questions here to be tackled, which I will do presently. If you have got a question yourself, feel free to ask me. Happy to answer them live, or you can post it somewhere and I'll answer it next week. I'll do this every Tuesday. I presume I'll be doing it next week. I'll kick off if that's okay. In breast augmentation, do you have to have scars under your breasts? Perhaps you could put the scar on the side of your breast instead. Yeah, you're absolutely, you don't have to have it on the under your breasts. You can have it kind of on the side. Actually, in the armpit is a relatively popular thing, certainly worldwide. It's a popular way of putting them in. It's called transaxillary. The other way you can put them in is infraareolar, which is like a U-shaped, half-moon shaped incision on the bottom of the areola. So those are the three kind of common routes to insert implants, and they've all got pros and cons, and understand why you might not want them in the under your breast in the fold, because it can be visible. It's quite hard to see. You have to kind of lift up. I understand it might be visible. So therefore, the transaxillary approach is preferable in that regard, because it's in your armpit. But if you, it really depends on the surgeon as to what you're familiar with. And I think most surgeons in the UK do the what's called the inframammary approach, which is in the fold of your breast. And it's certainly the way I do it. And I don't do the transaxillary, the armpit one, because I would struggle to create a cleavage. You're quite far away from the cleavage area, which is quite an important area to make a nice pocket when you're doing the surgery. And you're quite far away if your incision is in the armpit, and it can be difficult to control the bleeding. There's some quite big blood vessels around the cleavage area. And that's what worries me. That's why I don't do it. But there are some very good surgeons who do it. So I'm not saying it's bad. That's just me. Admittedly, most of the surgeons are overseas for whatever reason. I don't know why the UK doesn't do transaxillary, but I know people overseas in Europe who do a lot of transaxillary. It's popular there. So it's one of those ones which I guess it's like many things. If your surgeon is confident with that technique, then that might be the right thing for that surgeon to do. Certainly, when I've had patients come and see me and want a transaxillary approach, I'd say no, really, because it's not something I've done, and it's not really something I'm confident doing. And so I feel like my expertise is the inframammary approach, and you might find someone else who's got expertise in the transaxillary approach, who's maybe hasn't got expertise elsewhere. The infraareolar approach is, I sometimes would do that. It's a very common approach for accessing the breast in men, and sometimes you put implants in from around the areola, but I don't routinely use that one either. For some reason, in America that's popular. So why infraareolar is popular in America, transaxillary is quite popular in Europe and the UK. We do inframammary. Just shows you there's no right way. We're all gonna argue our corners, but I don't think any of us can say it's the best way, because if we could, then everyone would do it that way. So the answer is yes, you can put it on the side of your breast, or at least in the armpit. But the trick, we find a surgeon who'll do it for you. Certainly in the UK, I don't really know anyone who does it regularly, but I guess there's probably someone out there. Gabrielle, Rebecca, Charlene Whetstone is the comment. Is that tagging someone in? Never know what that means. Is that what tagging someone in means? Has Gabrielle tagged Charlene? Anyway, I'm assuming that's not a comment, Gabrielle, but thanks for the comment. It all helps. Holly's got a big one. What you got, Holly? I have a pocket. Oh God, it's scrolling. I have a pocket of fat under each armpit that developed during pregnancy and has stayed. I'm back to my pre-pregnancy healthy weight. However, pockets of fat have stayed. I've inquired with 2 cosmetic surgeons, but both have said they can't help. I did leak milk from one of the pockets of fat during pregnancy, so I'm not sure if that's complicating things. I'm surprised that you've seen plastic surgeons who say they can't help, Holly, because that sounds very much like what we would call accessory breast tissue, pockets of fat underneath your armpits. And I would have thought most plastic surgeons would kind of be okay with that. Mind you, you said 2 cosmetic surgeons. Were they plastic surgeons, Holly? Were they specialists in breast? Hey, never accept a lift from strangers. How to find the best plastic surgeon for your cosmetic breast surgery. Written a book about it. So yeah, certainly from what you described. I mean, it's difficult on this sort of stuff because you're kind of like, you're just doing it, by over the ether. So if you've actually seen a surgeon, then maybe that's got more weight than what I'm going to say. But what I would say is what it sounds like is accessory breast tissue. It's unlikely the leaking milk. So has it got a nipple on it? Did the milk come from a nipple? But either way, they can be removed is the answer, and usually they are just fat, as you say. And the 2 options for treatment are liposuction or excision. If you're leaking milk from it, that suggests there's some breast tissue in there. Breast tissue is a bit firmer than fatty tissue, and so it doesn't come out with liposuction. So that would be like a mark against liposuction. The mark for liposuction is the scarring is a lot less than when you do excision. When you do excision, you actually literally make a scar, which can be visible. Whereas liposuction, there's no visible scarring. We sort of hide it in the armpit, and there's usually little stab incisions. The other issue with liposuction is the potential for the skin to be left. So it depends on how big they are and how much they've stretched the skin as to whether liposuction would be sufficient, because liposuction would just remove the tissue underneath the skin and it wouldn't remove skin. So it might be there'd be some redundant skin there. So again, there's kind of pros and cons of liposuction and excision, and kind of needs a discussion. But the thing you're describing is something that I think that there would be plastic surgeons out there who would be familiar with it. And it sounds like, as I say, accessory breast tissue is what we would call it, and it is not. It's not that unusual, Holly. It's something you do see. I've certainly treated a couple of people in the last 6 months or so, although I'm not doing people anymore, not seeing new patients myself, but certainly in the last year, probably that's treated 2 or 3. So it's not that common, but it's not that uncommon. Assuming that's what it is, Holly, because I might see it and think, oh crikey, that's something completely different, or I don't know what that is or something, but sounds like accessory breast tissue. Thank you for the comment, Holly. Gabrielle, yes, I tagged her so she can watch. Right, thank you, Gabrielle, for explaining that to me. Where do we message for a price list? You can message here, Gabrielle. You can also go on the website, staianoplasticsurgery.co.uk. And actually, for accessory breast tissue, is it? Oh no, Gabrielle, no, that's Holly. Sorry, getting mixed up. So if you go on the website, Gabrielle, and you go to the page of the thing that you're interested in, and you say request a quote or something, request a price, I think there's a button, and it will email you an email with information about the thing, whatever whether it's tummy tucks or breast reductions or mole removal or whatever, with information about it. So we haven't got a price list, but we'll email you prices of the thing, or you can message here. Amy will get back to you tomorrow. Can you direct message? Do you have to be a friend to do that? Are you allowed to do that? If you or just comment? I don't know, Gabrielle. There's loads of places. Website's probably your best bet. I think I handled that one quite well. It's just from photos I've sent. I haven't seen anyone face to face. Okay. All right. Well, okay. Not breast specialists will note that. Yes. Holly, yes. Thank you. Really knows normally called and all the addition. Thanks so much. How does the price compare to breast surgery? Do you know? The price would be. How does it compare to breast surgery? So it's a bit of a niche thing, Holly. It's not something that would be like it's as I say, it's not that common. We've treated it a few times, but it's not that common. So I don't think it's kind of it would be a like. I think the thing to do is send us a photo, Holly, and we'll have a look. And it's probably less than a bigger op, more than a smaller op. That's helpful, isn't it? I mean, it's probably less than having breast implants or a breast reduction or something like that. Well, it will be less than that for sure. Don't know, Holly. I'm not good on prices. Gabrielle, can you remove glands before placing implants? Are you saying like do a breast reduction there, Gabrielle? Like remove the breast and then place implants? Is that what you're saying? That is a thing that some people do because they don't want to be bigger. They don't want their breast to be bigger, but they want the fullness that you get with implants, and particularly even if they want to be smaller, sort of thing. Because that, for me, I would say would be a lift, but a lift you don't get it as full as you do with implants. So some people will actually reduce some of the breast tissue, if that's what you mean by the glands, some of the glandular tissue, and then replace it with an implant to get a more fullness in the upper pole. I don't like that. I'll be honest with you, Gabrielle. I don't like removing breast tissue and replacing it with implants, but it's something that people do. I think they call it the plus-minus technique or something. But no, the Montgomery gland or something I'm having issues with. Montgomery's tubercles, are you talking about the Montgomery's tubercles, the little kind of dots on the areola? Is that are you having issues with that? So can you remove? You can remove them, I guess, Gabrielle. If you're having issues with it, like blocked ducts or problems like that nature, it might be a breast surgeon, Gabrielle. Having said about choosing a plastic surgeon that specializes in breast, this is why it's so confusing. That's why, because you might think, he's written a book on it. What is there to talk about? It is quite confusing because there are plastic surgeons who specialize in all different areas: head and neck, hands, burns, cleft lip, craniofacial, skin, breast. So there's all sorts of areas. So you should find one that's specialized in breast. And even and so people who treat breasts, there's two types of surgeons: there's plastic surgeons and general surgeons. And general surgeons do things like breast lumps and breast cancer. And so if you're having problems with the ducts, with the Montgomery tubercles or something like that, that might actually be a breast surgeon rather than a plastic surgeon. So a breast surgeon is a general surgeon who's specializing in breast, who does cancer treatment and removes lumps and what have you. So there are general surgeons that specialize in breast, who are called breast surgeons, and then there are plastic surgeons who specialize in breast, who are, well, they're still called plastic surgeons. They don't change their names. The general surgeons who specialize in breast sometimes do some reconstruction as well as the mastectomy. So when I was in the NHS, the general surgeons did the mastectomy, and then then we would do the reconstruction. But there are some general surgeons who are now training to do the reconstruction, and they're calling themselves oncoplastic surgeons. Onco being cancer. So you see, it's a bit of a minefield, I'll be honest with you. But yeah, so it might be. Holly, thanks. So I really appreciate it. I'll contact your clinic. Yeah, good, Holly. Please do. Gabrielle, yeah. Seen one, and is that a breast surgeon? Okay. Breast surgeon's useless, is it? Oh dear. Seen 3 through NHS. They're useless, honestly. So thinking private and get the glands done, then the implants. Yeah. Yeah. Not, I mean, the glands thing is not a common thing. Having said I've treated a few people with accessory breast tissue, I can't remember treating someone with problems with their Montgomery's glands. They're Montgomery tubercles. They're your little dots on the areola. So that is even more rare than Holly's thing. But for sure, yeah. Um, mm. Right. What have we got here? Got another question. Um, are all the scars hidden if you have a full tummy tuck or breast enlargement? So breast enlargement, yes. So as I say earlier, we normally put them on the in the inframammary folds. So I say they're hidden. They're kind of hidden on the inframammary fold. So from the front, you can't see them at all. But if you put your arm up, or if you sort of lie down and like do that, you can see them. Certainly in the first few months, then they do fade. But they can take 6 or 12 or even 18 months to properly fade. But they are kind of hidden in a bra, put it like that. And even one, so if you go back 10, 15 years later, if you have to change the implants or anything, they're actually quite hard to see. So they usually fade really well. So that's the breast implant, breast enlargement. Tummy tuck. So full tummy tuck's got 2 scars, one big long scar from hip to hip and one around the belly button. So we're always aiming to hide the one from hip to hip in your underwear. Now it's difficult to 100% guarantee that, and certainly you're helping us out if you wear wider underwear, underwear with a wider band, if you like. If you wear quite a thin band, it's we might not get it all spot on hidden in your underwear, so it might be visible in kind of skimpier underwear. If that's important to you, you can always bring the sort of pants you want to wear, and we can mark them to try and get the scar to lie in that area, although there's still no guarantee. But certainly with a wider pair of underwear, we would aim for it to be hidden. But there is a scar also around the belly button, and that's not hidden in your underwear. So that can be visible, although again, we try and hide it kind of inside the belly button, so it's not kind of visible from the skin. So we do our best to make it so that you can't see that you've had a tummy tuck, but the belly button scar is potentially the kind of one that would be a giveaway if you're in a bikini or if you're in your underwear. And we try and hide the other 2 as best we can. Gabrielle, but you're back. Yeah, it's around the outside. The milk ducts get infected every couple of weeks. That does sound like a general surgeon, Gabrielle. I've got to be honest. If you've got kind of recurrent infections around the milk ducts, that's more of a general surgeon issue, and I think they do they would treat that rather than a plastic surgeon that specializes in breast. Do we offer skin grafts instead of tattoo excision? Can I just I've got something. So I think all right for a minute. Do we offer skin grafts instead of tattoo excision? No. Well, I am one of the few. Can you see that burn? Burn my hand just now. I am one of the few, it seems, plastic surgeons that does tattoo removal for reasons I don't know. Patients say they've seen lots of people who've who say they won't remove tattoos. As far as I'm concerned, it's like removing any piece of skin, really. So we do quite a lot of tattoo excision at the clinic. And this is a personal kind of view. My personal view is that I don't like doing skin grafts. So I'm not sure if the people realize what a skin graft looks like. It doesn't look like skin. It's not got any. It's not pliable. It kind of stuck down. There's often a bit of a contour irregularity. It's cosmetically, it's not a good thing. And I know that people just want their tattoo removed, but we've got to be very aware of the cosmetic outcome. So personally, I don't like doing that. And my preference for a larger tattoo that couldn't be cut out and stitched up, obviously it can be cut out and stitched up, then we do that. So this question is talking about ones that you can't cut out and stitch up. So ones that you can't cut out and stitch up because they're too big, my preference would be what's called serial excision, which means cutting out as much as we can and then leaving it 4 months and then cutting a little bit more out and then cutting a bit more out. It's a little bit, well, it's more tedious, not a little bit more tedious, quite a bit more tedious, but at the end of the day, it just leaves you one scar, and it's a better way of doing it than a skin graft. Not all tattoos are suitable for it, and you know, if you've got a big thing on your shoulder or something like that, you know, it's often just a no from me. I wouldn't put a big skin graft on. I just think it would not look good at all, and so it's a no from me. But people do, as I say, not many plastic surgeons even do the excision. So I'm sure there are people out there who would, but I'm not one of them. I think I'm going to take the stuff out of the oven. Sorry, I'll do this in a sec. Sorry. Jack, can you just take that thing out of the oven, the top oven? Just put it on the top. Sorry. Yeah, just got out of the oven. I've burnt it already. What implants, as in the material make, do you use? So the material is, to be honest, there's not a huge option. So the material of the implants, in terms of the contents, you can have saline or silicone. In this country, we mainly use silicone implants, which are silicone gel. And there's one company in America that makes that silicone. So all the implants have got the same silicone inside. There are different materials of the shell. So they've usually got they've all got a silicone shell, and then some have got a polyurethane coating around the outside of that shell. And the polyurethane is one company again in the world called Polytech. So if you have polyurethane implants, Polytech are the only company that make them. If you're having a silicone shell with a silicone gel implant, there are several companies. I'm not particularly tied to any company, so can use any of them. Polytech I use a lot of, simply because I use them for the polyurethane implants, and I'm familiar with the range, and I think they're a good company. Nagor, Motiva, there's lots of companies I don't really use. Seba, Eurosurgical, Mentor, a big company. So there's lots of companies out there, but personally, it's usually Polytech are the main ones. A bit of Motiva, Nagor as well. Use Nagor as well. So those are the ones that I use. But as I say, if a patient's got a view about it and the hospital can get them, I'm not tied to any particular implant company. So yeah. What anaesthetic do you use when having breast implants? These days, GA, general anaesthetic. Around the lockdown, we were doing a lot of local installation, and we can still do local installation. But what I'm finding is when I'm working in the hospitals that can do both, they default to general anaesthetic because they say the local installation is quite heavily stated and the airway is not protected. So it's like anything, there's pros and cons of them. But the most places that do a lot of local installation seem to be places where they can only do local installation. And in places where you can do both, they seem to prefer GA. And I'm kind of guided by the anaesthetist, unless someone's got a strong view about it and they want local installation. That's fine. We can offer local installation, no problem at all. But if you kind of leave it and discuss it with the anaesthetist, they often go for GA. But again, like anything, pros and cons. I don't think there's any best way of doing it. Otherwise, we'd all do it that way all the time. And the fact of the matter is, some people do it GA, some people do it local installation. So there's pros and cons of both. But yeah, personally, it's mainly GA. Although, as I say, I have done quite a few under local installation, and it's been fine. So I'm happy to do it under local installation. I had a breast reduction surgery 8 weeks ago. I was treble D before surgery, but now I'm still a D double D. The surgeon agreed B, but he removed only 1 pound in total. What should I do to reduce the size? Well, this is why I never agree the size. So, you know, you say I'm a treble D and I want to be a B, I'll be like, I'll take that on board, but I cannot guarantee the cup size, because the first question is, what about the back size? Has the back size changed? Because if your back side's gone down and your cup size has stayed the same, well then that they're smaller, because your back size shouldn't change. Just to be clear, your back size should not change when you're having a breast reduction, but often people are wearing the wrong back size pre-op, and they get measured post-op with the right back size, and they go to a smaller back size and a bigger cup size, and all of a sudden they think they haven't had a reduction because the cup size hasn't gone down much. I don't know if I'm making sense there. So if they stayed the same size, so if you were something like a 34 treble D, and now you're a 32 D double D, well, pre-op, instead of being a 34 treble D, you'd have been a 32 E or F. So you've gone from an E or an F to a D double D. That makes sense? I don't know if I'm making sense here, but the point is, it's very difficult to be too accurate about cup sizes. The bottom line is whether you feel like you're smaller and whether you're happy with the size of your breasts, not what size you are. It doesn't matter what cup size you are. It matters whether you're happy with the size. If you're happy with the size, great. If you're not happy with the size, not great. So I always try and get patients not to be too fixated on the cup size, because it's very hard to predict. So that's the first thing. I think you're on a. It's not good to agree with patients' cup size, because it's impossible in my experience to predict the cup size. That's the first thing. So only remove 1 pound in total. 1 pound's not too. Is fair amount, I would say. Or you mean in total from both breasts, or anyway, whatever. What should I do to reduce size? So often it's a skin tightening process as well as a reduction of volume procedure. So often the lift is a main part of it, as well as reducing volume. So the only thing I guess you can do now to reduce the size is weight loss. But I would always say to people, you need to really try and lose weight before surgery. So it's not ideal losing weight after surgery, because they could droop. So it's not great. But that's the only thing I could say that you could do to remove more volume. Well, non-surgically, obviously surgically you could have liposuction, but again they could droop, because that would be just taking out some of the heaviness, or another breast reduction, I guess, but that's a bit extreme. So there's the surgical options, but non-surgically, yeah, weight loss. The other thing is good, well-fitting bra and things, and again these sorts of things are things it's probably best to look at pre-operatively, but a well-fitting bra can help with a lot of the problems people get when the breasts are a bit big and heavy. So that's one option. Again, it's not reducing your breast, but it might make things a bit more comfortable for you. Right, so hopefully the dinner's not burnt. I better go and check on it. I hope that's been helpful. Much love to Gabrielle and Holly and Charlene, who she's tagged in. So I hope you find this, Charlene, and find it helpful. If you've got any questions, just call me or message me, or well, those are the main ones really. Call me or message me, and I will do my level best to answer them. I'll be back next Tuesday for more of the same. So wish me luck.